Hi everyone, this is Sarah and I'm here to tell you how to identify the bones on the skull. So I'm going to start out with the sutures. The sutures separate the skull bones, and they're a type of joint, so you can sort of see them on the top here. This one that goes across the skull in a frontal section is called the coronal suture. Corona means crown, and so if you were to wear a tiara, it would set right there on that suture. Next, we have the squamous suture. This is on the side of the head. Below it is going to be the temporal bone right here. Above it will be the parietal bone. We have the sagittal suture. The sagittal suture goes along the mid-sagittal line from about halfway back towards the back of the skull. And then on the very back of the skull, we have the lambdoid or lambdoidal suture. So this goes just over the top of the occipital bone, which is down here. And these two are the parietal bones. So occipital bone, parietal bones, coronal suture, frontal bone. We had a couple parts of the occipital bone to learn on your list. So if we look at the back of the skull, here's our occipital bone, and towards the bottom of the occipital bone we have this large hole. It's called foramen magnum. Foramen means hole, magnum means big. That's the hole where your spinal cord comes out of your skull. And these two bumps right next to it, those are the occipital condyles, and they are going to sit right on top of the superior articular facets on the atlas, which is your very top vertebra. Next, we have some parts of the temporal bone. So we have temporal bones on both sides. This is the temporal bone here, and it goes right to about here. You can see that little joint where you have the edge of the temporal bone. This little indentation right there, that's the external acoustic meatus. That's where your, basically some of your hearing apparatus from your ear is going to be in there. This bump right here, which you can feel kind of behind and below your ear, is called the mastoid process. It's a good place for muscle to attach. There's a muscle called the sternocleidomastoid that's going to attach there. This pointy bit here is the styloid process. There will be a few other bones in the appendicular skeleton that also have a styloid process, and it's always going to be a pointy part, kind of like a stylus that you would use to write with on a tablet or something is pointy. This part of the temporal bone right here is called the zygomatic process, and it's going to connect to the zygomatic bone right here. And kind of the whole thing all together is called the zygomatic arch, but that's not part of your labeling. Next we have the mandibular fossa. So on the bottom of the temporal bone right here, a fossa is a depression. So that little depression is where your mandible is going to fit. So if I take the mandible, it fits right there into the mandibular fossa. Next we have the carotid canal. So if we look kind of on the bottom here, we have these two holes. The large one on the top is the jugular foramen. That's where your jugular vein is going to go through. And this smaller one just below it is the carotid canal. So jugular foramen top, and then just underneath it is the carotid canal where the carotid artery will go through. Next, we're looking at the sphenoid bone. So the sphenoid bone you can see in a few places. It's in the back of the eye socket, and there's a little hole in the back of it. You can sort of see that little hole, not the long skinny one, but the little one next to it. That is going to be your optic canal where the optic nerve goes through. And if we open up the skull, on the inside, this kind of middle area that looks like the bat-shaped bone, that's the sphenoid. And this part right in the middle of it is the sella turcica, which means Turk's saddle, and that's where your pituitary gland is going to sit. Next we have the ethmoid bone. The ethmoid bone, from the top of the skull, you can see part of it right here, this little triangle, and it has all these tiny little holes, which are the olfactory foramina. That's where your olfactory nerves come through for smelling. And you can also see it inside the nose. The upper part of this division between your nostrils is part of the ethmoid bone. And these two little bits sticking out on the sides are the middle nasal concha. Not part of the ethmoid, but the other two little bits down below, those are the inferior nasal concha. And the lower portion of the division between your nostrils is called the vomer. Next, we already did the sutures. We have the cranial fossa. So looking inside of the skull, these are the big depressions. A fossa is a depression. So this whole depression in front, that's the anterior cranial fossa. This whole depression in the middle, that's mostly the sphenoid, that's the middle cranial fossa. And this whole depression in back is the posterior cranial fossa. A few more bones we've got. The nasal bone, this little one right here. The zygomatic bone we already did. The palatine bone is this kind of small one right here. It's a little bit hard to see the border of it on this skull, but that's the border right there. This front part is the palatine plate, which is part of the maxilla. Palatine process, not palatine plate there. So we've got the palatine bone back here, and this is the palatine process of the maxilla. The maxilla is this whole bone that forms the upper jaw here. We did the vomer, and then we just need the mandible, I believe. Oh, and the lacrimal bone. Lacrimal bone is this tiny little one on the side. It's on both sides of the nasal bone. That's where your tear ducts go. And then the maxilla, we already did. The mandible is your lower jaw. This main part of it in front is the body of the mandible. This part going up the side is the angle of the mandible. This right here is the angle of the mandible. This is the ramus, which means branch, coming up the side. So body, angle, ramus. And then this tiny hole that we've got two of them in front, that's the mental foramen, because your mental region is right there. You've got it on both sides. And that's the skull bones.